HOU11 app.
Welcome back. Are you constantly taking allergy medications? Maybe you suffer from chronic headaches, fatigue, or facial pain and pressure. Instead of masking the symptoms, one procedure could help you cure the underlying problem. Here to explain, please welcome back Dr. Kevin Smith with the American Sinus Institute, along with his patient, Jack Cooper. Good morning.
Good morning.
All right. A lot of people just say, look, you live in Houston, that's just what's going to happen.
No.
But yeah. And again, like we mentioned earlier, if you keep taking medications on a constant basis, it's not really getting rid of the problem.
It's an indication that there's a problem there, and you need to get to the root cause of the problem. And so what we do at American Sinus Institute is do just that.
Yeah, okay. Explain to us what our sinuses are exactly.
Well, your sinuses are air-filled cavities in your head. You have 8 of them. They're paired. They actually make the head weigh a little less. But they also produce mucus. They help filter the air, warm the air, that kind of thing.
Kind of a little plumbing system, plumbing, heating, and air conditioning system.
You know, it's funny you say that. I tell my patients that all the time. I'm like a plumber of the human body.
Yeah.
If you can't breathe, we make you breathe better, and your symptoms get better.
All right. And when the symptoms are bad, they're bad, right, Jack?
Right.
Okay. What was life like when you just were constantly battling with sinus issues?
Terrible, miserable. It just wasn't, you know, just like you want to get up, bathe, or shower, they won't do nothing.
Yeah, just shut you down completely.
You're right.
And oftentimes those symptoms can be one or a number of them, Dr. Smith, and it just makes you miserable, like you said.
Yeah, in Jack's case, he had a lot of chronic sinus problems, nasal congestion, runny nose, drainage, coughing, can't sleep well, headache.
Yeah, sounds like you
needed
one of those medications where it said like multiple symptoms.
That's right.
And of course, a lot of people do that. They get those were you taking the over-counter medications that had all the multiple? How was that working for you?
No, it wasn't doing anything. It worked maybe 20 minutes, then it come right back.
Yeah, and of course.
But this guy here, what he did, it ain't come back.
It ain't come back.
No.
All right. Well, and the problem is that a lot of times we take these over-the-counter medications, what we're doing is causing more damage. And then, of course, some of those medications our body doesn't like to tolerate.
That's true. I mean, you have side effects to all medications that you take. So if you don't have to take it, why do that? And then to do it chronically over years cannot be good for the body.
Right.
So what we do, and what we did with Jack, is we brought him in and did what we call balloon sinuplasty, where a little balloon opens up and dilates the channels of the sinuses. We reduce some of the swelling tissues in the nose that cause them to be congested and cause his ears to get stuffy. Yeah. And just overall...
And infections to happen, all that stuff, because it's really an incubator for bad bacteria, too.
Exactly. If there's not any proper way for the bacteria and the mucus to get out, it's going to get infected. And when that happens over and over again, then the tissues get swollen.
Yeah. All right. So like you said, the balloon sinuplasty. So you go in, you open up those channels.
That's right.
And that's done under anesthesia?
It's done under anesthesia. It takes about 20 minutes to do the all 8 sinuses and the turbinates and straighten the septum out. We can irrigate the sinuses, as illustrated here.
Yeah.
If there's any mucus in there or pus, that can come out, and then the next day they're ready to go.
Yeah, because when you can breathe, the air can get up there and the airflow can clean things out. All right, so once it's opened up, is it opened up for good?
Pretty much so. The studies have been done over in Europe, and the patency rate after balloon sinuplasty is around 95, 97%.
All right. So, Jack, when did you first start noticing a difference?
Just as soon as they woke me up from anesthesia, I noticed a difference.
You could breathe.
Yeah, right.
Wow.
I could feel it's gone. You know, like I was healed or something. You know what I mean?
Yeah, yeah. And you know, it's important because people. Did you lose your sense of smell too, and then sense of taste?
I've been on the verge of not, losing the sense of smell. But when they woke me up from anesthesia, I could smell.
Yeah.
You know, I was losing the smell, but when I woke up from anesthesia, I could smell.
So Thanksgiving was a little different this time around.
Right.
You gained some weight?
Right.
Yeah, right. Because I smell the food. I want to eat that food.
I gained a couple of ounces. I got on the scale and weighed a couple of ounces at Thanksgiving.
All right, the American Sinus Institute, as I mentioned earlier, what we're seeing happen in medicine is kind of fine-tuning a service, and that means the skill level's at its highest for that particular thing. So American Sinus Institute, a team of 7 ENTs.
Yes. Overall, we've done about 3,000 of these procedures. Again, the average procedure takes about 20 minutes. The patient might be there an hour and a half or so just getting prepped before and after the procedure. But you're looking at 1 day downtime the day of the procedure. You can go back to work the next day in most cases. And most people, like Jack said, I mean, he was feeling good as he was recovering.
Before he was out of the room.
Exactly.
Yeah, and the great thing is a lot of people have some time off, that's coming up here, so this might be a good time to get that done. For more information on American Sinus Institute, you can call 713-BALLOON. 713-BALLOON. That works out to be 713-225-5666, 713-225-5666, or log on to americansinus.com. calm and start feeling better and toss all that other medication. All right.